So welcome, welcome, welcome. I'm going to go ahead and proceed. I know that people are still coming in and we do understand that, but we do kind of remain punctual because we have a jam-packed conversation for you. So my name is Jarrell Hines and I want to welcome you on behalf of the Office of Community Engagement to the March Community Cancer Forum, where cancer, community, and conversation connect. So as you know, last month was Colorectal Cancer Awareness, and it was so nice, we decided to do it twice and double it. So March is Colorectal Cancer Awareness Month, so we're giving acknowledgement for that. And then from here, we'll start with our pre-welcome. So good morning, everyone. I want to thank you for choosing to be here, for choosing information, for choosing community, and for choosing to take your health seriously. That decision alone is powerful. Today, we're talking about something that is changing right in front of us. And it's not just the gas prices. It's colorectal cancer, and it's getting younger. We're seeing more cases in adults in their 20s, 30s, and 40s, and people who never imagined they could be at risk. And when a disease starts shifting like that, it demands our attention. It demands our voice, and it demands our action. There are a few truths we can't ignore. Family health history matters, inherited syndromes matters, and knowing your risk is not optional. It's essential. But there's another truth that gives us hope. Prevention is powerful, and so much of it is within our control. Researchers are working hard to understand why younger adults are being diagnosed more often, and one of the biggest questions is the role of diet and lifestyle. And while we don't have every answer yet, we do know this. The choices we make every day, what we eat, how we move, how we advocate for ourselves, can lower our risk in real, meaningful ways. But today isn't just about the science. It's about the people. It's about the families who deserve answers, and it's about the communities who deserve access. And it's about making sure no one is caught off guard by disease. We have the power to detect early or prevent altogether. You'll also hear from our partners about work happening across our region to raise awareness, increase screening, and support risk reduction efforts, because it isn't just a medical issue. It's a community responsibility. And when community steps up, outcomes change. So as we begin, I invite you to listen with intention. Ask questions. Think about your loved ones. Think about yourself. Because the more we understand, the more we share, and the more we act, the more lives we protect. Today is about clarity. Today is about empowerment. And today is about changing the story of colorectal cancer altogether. All right, so now I have the pleasure of introducing our speakers for today. So our speakers for today are Dr. Jahar Gadar and Dr. Kumar. They are fellows from the Division of Gastroenterology and Hepatology and Nutrition at the Virginia Commonwealth University Health System. And their topic for today will be our part 2 of colorectal cancer. And we're really investigating the fact that it's getting younger and what you need to know to protect yourself. So you will get some discussion on the rates in younger adults, family history and inherited syndromes, and how prevention is powerful. So this is currently the future of medicine. I think these are top-notch docs. I think that you're going to be very excited by our discussion. And I encourage you to engage them with the same vigor that we have in the chat now. So without further ado, I will yield the floor.
Thank you, Jarrell, for that kind introduction. And let me just share my screen.
Yes.
Perfect. Hopefully everyone here can see the screen. So once again, Dr. Kumar and I are really excited to talk to all of you today about colon cancer. March is Colorectal Cancer Awareness Month. But hey, Dr. Kumar, are you here? Hi.
Hello, Dr. Jahagidar. First of all, thank you everyone for joining in, and thank you the Community Reach Outreach Program for giving us this platform to share our little wisdom we have about this. As Jarrell said, colorectal cancer is becoming younger, so we'll try our best to make you guys giving you some education and some pearls which you can take home and help your loved ones.
Exactly. So I'm really glad we are having this conversation today, Dr. Kumar, with everyone, because colon cancer is one of those diseases where awareness truly, truly saves lives. And let me start with a reassuring fact for everyone here. Colon cancer is actually one of the most preventable cancers that we know. However, prevention only works if we know when to get screened and what symptoms to watch out for. I promise we'll talk about colonoscopies today in a less scary way than what Google must have told you last night. But hey, you guys should listen on today.
All right, so let me break the ice. Okay, I just wanted to ask you, the most important thing about this cancer, right? We all talk about colorectal cancer, and we all want to like prevent cancer. But tell me why exactly screening is so important for colorectal cancer, Dr. Jahangir?
Yeah, good question, Dr. Kumar. Colon cancer currently is the third most common cancer diagnosed in both men and women in the United States. It is the second leading cause of cancer related deaths. Every year, Dr. Kumar, 150,000 Americans are diagnosed with colon cancer, and around 50,000 people die from colon cancer. But hold on, here's the key point. Screening dramatically reduces both the risk of developing colon cancer and the risk of dying from it. Why? Because colon cancer develops slowly. Most cancers start off as a small growth called a polyp, which are essentially tiny bumps in the colon lining. If you're able to find these polyps during colonoscopy and remove them, hey, we're able to prevent cancer from forming in the first place. In medicine, we love prevention. It's always better to remove a tiny polyp today than treat cancer 10 years later.
That sounds like a very smart idea, right? And no wonder we came up with this idea of preventing this cancer, which we can actually take the polyp out. You kept mentioning about this polyp. It's a tissue outgrowth. Tell me more about it. Like what exactly a polyp is?
Yeah, great, Dr. Kumar. We keep talking about polyps in colonoscopies, but what are these polyps? Polyp is basically a small growth inside the colon. The lining, think of the lining within your mouth. The same lining is continuous, goes through your food pipe, stomach, and into your intestines. A overgrowth of tissue in this lining is a polyp. Most polyps, Dr. Kumar, are harmless, but some types can gradually develop into cancer over time. The good news here is that this transformation takes years, often 5 to 10 years at least. Now, this slow process gives us a valuable window to detect and remove these polyps before they become dangerous. So, when we say that colonoscopy prevents cancer, we mean exactly that. We are removing precancerous growth even before it becomes cancer, Dr. Kumar. You can think of it like removing weeds before they overtake your garden. Except that in this case, the garden is your colon, which is admittingly not the most glamorous garden to talk about.
Well, that's really good to know. So if I'm getting a colonoscopy and if my polyps are removed, I'm in a way kind of preventing my risk of having cancer in future.
Exactly.
Wonderful. Okay, that sounds like a wonderful strategy as well, when it comes to prioritize my health. So why wouldn't I, right? However, one of one of the questions which always comes, especially for younger folks, hey, I'm just 50. Do I really need to get this? I always heard that colorectal cancer used to happen in old age folks. What is your take about that? Is it really getting younger?
Dr. Kumar, this is the reason we are having this podcast or this conversation today. We've been hearing more and more about colon cancer in younger adults. And this has been one of the most concerning trends over the last couple of decades. Now, like you rightly said, historically, colon cancer was mostly seen in older adults. But over the last 2 or 3 decades, we've been seeing an increasing incidence in colon cancer cases in people under the age of 50. Dr. Kumar, today, 1 in 10 colon cancers occurs in someone who's younger than the age of 50 years. In fact, colon cancer has become one of the leading causes of death in adults under 50. Now, most of these younger patients are unfortunately diagnosed after symptoms appear because they haven't reached the traditional screening age yet. And that is why our societies a couple of years ago went ahead and recently updated to start screening at 45. So 45 is the new 50. And hey, we should all start screening colonoscopies at the age of 45.
I keep hearing that 45 is the new 50. And based on the trends, the pattern I'm seeing in my outpatient setting too, it's definitely concerning. And imagine when you are at the age of 45 and you don't have any other symptoms and you get to know about that you have a polyp which can become cancerous. That is scary. because at that time you have all these big responsibilities on your shoulders too, and often people ignore that. So I'm so glad that you brought that point. Now tell me, sometimes, I've seen these folks often get diagnosed pretty late in their life. Uh, how did that happen? Like if cancer starts like in such a young age, it can start as young as like 40 and sometimes, often 45. Why do these people often get screened pretty late?
Yeah, and that's a question I've asked myself. Why do younger patients sometimes get diagnosed later? I think, Dr. Kumar, there are a few reasons for this. Most people, under the age of 45 are never routinely screened. Our screening guidelines also talk about 45 being the age to start colonoscopy. So cancers are often detected in this age group only when symptoms develop. Now, secondly, what we see very often is that these symptoms are attributed to more common conditions. They think it's their hemorrhoids, they think it's irritable bowel syndrome, and often tend to overlook. Hey, many young people, including me, we think I'm too young for cancer. Unfortunately, cancer does not read this textbook. Increasingly, physicians now are being trained to avoid what we call anchoring bias, which means not dismissing symptoms just because someone is too young.
I see. No, thank you. Thank you for sharing that. You mentioned that, often symptoms are kind of ignored. Sometimes, patients, they complain that they might have hemorrhoids. But what are these symptoms you're talking about? Like if I'm a regular adult, what else symptoms and, things I should be look out for?
Dr. Kumar, this is something I tell my patients, and this is something everyone should take home from our conversation today. There are several symptoms that should prompt evaluation. Now, these include rectal bleeding or blood in your stools, a persistent change in your bowel habits, which means either a lot of diarrhea, constipation, alternating diarrhea and constipation, unexplained weight loss, where you're losing more than 10% of your body weight, you have a low appetite, iron deficiency anemia, where you're losing blood. Don't always have to notice that you're losing blood in your stools. Sometimes we call this overt GI, latent GI bleeding, where you don't see overt blood in your stools, but maybe still shedding from your colon. One of the main presenting features of anemia is fatigue, or if you have symptoms like persistent abdominal pain. Now, I want to reassure everyone on this call that these symptoms are most commonly caused by benign conditions. But that being said, you have to get yourself checked and talk to your doctor to see whether these are concerning or these may be attributed to something else.
All right, that's a very key features that we definitely should be at least aware of first, and then obviously if we experience something of that nature, we should make sure that we address these, especially by bringing these symptoms to our primary care physician, and then from there onwards, they can direct us to us basically if someone really needs a colonoscopy. So, I'm throwing the ball on your court again. So tell me, if someone gets these symptoms and if they want to get screened for colon cancer, what exactly is the age cutoff? And are there any special scenarios where the families and the patients should get screened even earlier?
This is a great question, Dr. Kumar. So, repeating once again, but 45 is the new 50. For most adults, screening should begin at the age of 45. However, like you said, some individuals need to start screening earlier. Who may they be? These may be patients who have a family history of colon cancer, especially if they have first degree relatives, which could include their parents, their siblings, or their children with colon cancer. They may start screening earlier at an age of 40. Similarly, if they have a history of inflammatory bowel disease, or if they have certain genetic hereditary syndromes running in their family, they may need to start screening colonoscopies earlier before the age of 45. But one thing to remember is that screening is for healthy people without any symptoms. If there are any symptoms like the ones we spoke about earlier, we require evaluation or a diagnostic colonoscopy. And at that point, you don't have an age cutoff of 45. That's why if you have any of those symptoms like persistent rectal bleeding, change in your bowel habits, you can go ahead, meet with your primary care and decide if a colonoscopy is required, even if you're less than the age of 45.
All right, thank you. Um, we're getting a lot of questions in the chat. We'll try to answer them, in the Q&A session. Great. So, you just mentioned that, screening is really the important thing. We should definitely, at the age of 45, and if you're having all these risk factors, have family history, you should definitely get screened, right? And the screening modality is basically colonoscopy. And I'll be honest with you, before getting into this profession, colonoscopy sounded a bit more of, intriguing and invasive procedure to me. So tell me what exactly a colonoscopy is.
You are absolutely right, Dr. Kumar. Colonoscopies definitely have a bit of a reputation. Now, this is what I think the most challenging part of a colonoscopy is preparing for the colonoscopy or the bowel prep, which involves you drinking this cleansing solution that gets everything out of your colon. So when we go in with our camera, we are able to get great views. The procedure itself is pretty straightforward. Patients receive sedation, so they're comfortably asleep. I've had patients tell me this was the best sleep they've had in months after their colonoscopy. We use a thin, flexible camera, as thick as my finger, to carefully examine the colon. If any polyps are found, those can be removed immediately. Procedure generally takes around 30 to 40 minutes, depending on what we find, and most patients can go home the same day after the procedure. Benefit of colonoscopy is huge. If the colonoscopy is normal, you don't require another colonoscopy for screening for colon cancer for 10 years. So basically, one afternoon every decade for major cancer prevention tests. Don't you think that's a pretty good deal?
That sounds like a terrific deal to me. So if I have something, I can get it tested, resected, and I'm done for 10 years, depending on, how many polyps someone will find. I mean, that's definitely the smartest thing someone can do for their colon, right? But tell me, what if I still have some reservation with, with colonoscopy, and I just wanted to explore some more options. Do you have anything under your belt
Good
apart from
question.
colonoscopy?
So there are several options available besides colonoscopy, and some of them are listed on the screen right now. These can be easily accessed via primary care. These include the fecal immunochemical test, FIT stool test, or the stool DNA test, or the CT colonography. These are all non-invasive methods of testing for colon cancer, especially for people who prefer a non-invasive approach. However, remember, Dr. Kumar, if any of these tests come back positive, a colonoscopy is still required to determine the cause. If you were to ask me which is the best test, Dr. Jaha, I would say the best screening test is the one that gets done.
All right, that definitely makes sense. So yeah, it's important to get it screened first, and if something is positive, then we should, get a colonoscopy to get it double checked and make sure that we take that thing out. All right. Uh, Tell me one more thing. If, for example, I'm getting a colonoscopy and there is a polyp which is concerning, and you detect that, what happens next?
Good question. So you are thinking ahead now. Now,
Mm-hmm.
if colon cancer is detected, the treatment depends entirely on how early the cancer is found. If detected very early, the cancer can be removed endoscopically itself during the colonoscopy. However, more advanced treatment may involve surgical intervention, chemotherapy, and radiation, and this would involve a complex decision with our cancer doctors or the oncologists, the surgeons, depending on the stage, the grade, and how far the cancer has spread. It's always a multidisciplinary decision, but hey, the encouraging news is that when colon cancer is caught early, survival rates exceed 90%, Dr. Kumar.
Wow, that's really astonishing. No wonder this is so important for all of us. One more thing I wanted to ask you. You mentioned that at 45 we should get it, but what if I have some family history? What if like some of my relatives do have colon cancer, of which even I'm not even sure about? How does that play a role?
This is an important question, and this is something that I would really, really like to stress on today. Family history is extremely important when it comes to affecting your risk for colon cancer. So if you have a first degree relative, parent, sibling, or child, or if you know of your first degree relative having polyps or advanced polyps, this increases your risk and you should start screening earlier than the age of 45. Now, it may not be an ideal dinner table conversation to know how many polyps your relative had and what type of polyps they had. But hey, this does determine when you get your colonoscopy and how frequently you get your colonoscopy if your colonoscopy is normal. Especially something to keep in mind is how old your relative was when they were diagnosed with colon cancer. If they were diagnosed at an age less than 60, then we may repeat colonoscopies more often than not, just given that you are at a higher risk.
I see. So 60 is that magic number when it comes to the family age. All right.
Exactly.
Is there any inheritance in colon cancer?
Yeah, great question. And this is something we wanted to cover today. There are inherited forms of colon cancer. However, they are relatively uncommon. One example, as we have on our slide here, is Lynch syndrome, which is the most common cause of inherited colon cancer. This is caused by a genetic change that affects the body's ability to repair any kind of DNA damage. Patients with Lynch syndrome may develop colon cancer in their 30s or 40s, and they may not even have polyps before the cancer develops. Apart from colon cancer, these patients may have increased risk of other cancers, including uterine or endometrial cancer, ovarian cancer, gastric cancer. And that's why, when it comes to screening for colon cancer, apart from knowing if your relatives had colon cancer, it would be important if you're able to figure out if any other coexisting cancers like the ones I mentioned exist. Another condition, Dr. Kumar, causing hereditary colon cancer is FAP, or familial adenomatous polyposis syndrome. Here, patients develop hundreds to thousands of polyps in their colon, and generally they require surgery involving removal of the entire colon at a young age. Similarly, these patients who have hereditary cancer syndromes are screened earlier than 45, and sometimes even as early as their teens. But for this, you would need genetic counseling, genetic testing. The whole family tree is drawn out to understand if there are any connections.
That sounds very critical and important for someone actually, because if there is any inheritance
So,
pattern, then definitely
right,
we can catch colon cancer early.
yeah. So, Dr. Kumar, I spoke a lot about colon cancer screening and what we can be doing. Wanted to turn the ball around and hit it to your court. I know with your experience in nutrition and malignancies, I thought I'd ask you a few questions. Let's start about lifestyle. What do you think lifestyle does? And does it play a role in actually preventing colon cancer?
Well, thank you for throwing that question at me. I'm happy to. Okay, we got audience
No
support.
worries.
That's nice. All right. So yeah, talking about the lifestyle, right? So top researchers have demonstrated that up to 50% of the uh, factors which are kind of causing colon cancer are actually associated with lifestyle, even though it's a multifactorial uh, condition, which is kind of influenced by different things. Lifestyle definitely plays one of the biggest role. Apart from that, your food habits, your physical activity, and having a good healthy weight. All these factors are really important when it comes to, especially when you are looking to prevent colon cancer in oneself. So I definitely recommend to have an active lifestyle, trying to have a good balanced weight, trying to focus on a healthy diet, trying to eliminate processed meat. I think those are some definitely key factors which, if you implement in your lifestyle, can help you in preventing this cancer.
Absolutely. There are certain dietary patterns, especially whether it's processed meats or excessive alcohol use, that have been associated with a higher risk of colon cancer. We spoke about what you should not eat, but would there be certain types of food that support colon health, Dr. Kumar?
Well, absolutely, yeah. So, most of the diseases they start in your gut, right? And same thing happens with colon cancer as well. So I think the most important thing which we all can incorporate on our life is having a good fiber intake. And this is really important because an average American diet, we don't consume roughly around 20 to 25 gram of fiber, which is really key in maintaining a good gut health. If you see the labels in your food items, you can actually get a good estimate of how much fiber you're taking. And if you're consuming somewhere around less than 20, then I would definitely recommend you to increase the fiber intake. And that can be done by supplementing yourself with some fruits. Some good examples of fruits include squash or kiwis. Apart from that, you should definitely, be up on your vitamin D. Low vitamin D levels have been associated with some incidents of colorectal cancer. Make sure that you are up to date with your vitamin D screening. Make sure that you take good amount of calcium as well. I think those are some definitely important food factors which could play some role in preventing this cancer. Apart from that, I would also recommend having omega-3 enriched foods as well. And that can be found in, yolk, spinach, nuts. So definitely increase those food intake in your day-to-day life.
Thank you for sharing that, Dr. Kumar. I think fiber is something that we all would benefit from. And like you said, the target 20 to 30 grams of fiber is sometimes difficult to attain. Just to recall, an apple or a banana, how much fiber do you guys think it has? Dr. Kumar, how much fiber does an apple have?
It also depends if you're taking it with the skin or without skin, right? So
That's good.
yeah, so it's not a lot. Like, we think that an
Exactly.
apple
So
actually. Go ahead, please.
if you look at an apple or a banana, that gives you maybe 2 to 3 grams of fiber. And if you're targeting 30 grams, there's no way I can expect you to eat 10 apples or 10 bananas a day. A easy way of supplementing your fiber would be taking supplemental fiber, psyllium, in any form. One scoop has 5 grams of fiber, and you can slowly work your way up as you tolerate it. What I normally do is add a scoop in a glass of water, add a little bit of water, and just shot it down. That's the best way. But I think slowly working your way up and increasing your number of scoops of supplemental fiber, along with all these dietary sources, can increase your fiber intake dramatically. So I think we've covered a lot. Let's just recall some practical pillars for healthier colon, Dr. Kumar.
All right. So I think, uh, first of all, we should just focus on the fact that colorectal cancer is preventable. It's treatable. If we find early, we can fix it, right? So that's probably the most important takeaway from today's talk, that colon cancer is preventable, and if we are keeping a close eye on it, definitely we can prevent this deadly cancer.
I agree. Colonoscopy can prevent cancer by removing precancerous polyps. Screening starts at 45. And finally, healthy lifestyle choices and understanding your family history can help all of us reduce our risk. If there's one thing to remember coming out of our conversation today, it is that early detection saves lives. And having conversations like the one we just did today is the best way to spread awareness. So thank you everyone for joining, and I'll hand the mic over to Jarell.
Yay. Thank you so much. I think you shared a wealth of information. And I think as you've noticed from the chat, the community is ready and at your heels to ask you a few questions. So per usual, you guys, as you know, it is a lot of questions. So we're going to try to curate and get as many as we can. But what we do not answer, we will try to share those questions with our lovely providers today and see if we can get those answered for you as well. So starting off, I want to ask the question because I'm going to combine three from a few community members, but they really are looking to figure out a few things. So, firstly, um, we want to know, are primary care physicians sufficiently prepared to identify and screen young adults who may be at risk for colon cancer? And if not, how can we get this information out to primary care doctors?
Good question. I think, PCPs are the ones who are first line kind of when dealing with these patients, and it may be difficult to see a gastroenterologist in the first place. But recognizing that you're someone who may be at a higher risk because of your family history is the first step. And you may be the best person to know that. If you do have a family history, you can go up to your PCP, let them know, and based on your age, if you're closer to 40, they may be able to send you over for a colonoscopy. But one important thing that I wanted to mention, coming from today's talk, or take home point for all of you, is that screening is not for patients with symptoms. So if you have any symptoms, don't wait for 40 or 45. If you have symptoms, and especially if these are concerning gastroenterological symptoms, you may require evaluation by a gastroenterologist.
Mhm. Great, great. And I think you that was a nice piggyback into the next question because what happens, well, I want to know what is the best way to approach health concerns when your doctor does not seem to be understanding slash believing your symptoms. And I think that's really important with what we're talking about now. We talk about it already trending younger. I think it requires a lot of advocacy and kind of that with yourself. And some people may not feel as comfortable. So what is your suggestion in that circumstance?
I've been on the other side too. One thing I feel that helps is to be organized when you're presenting your issues. uh, Whoever you're presenting to, make a list of the issues you have, prioritize them. Sometimes what you may feel is very important may be something that can be looked into later, whereas something else that you feel is not important may be something that takes priority. Then make a list of all your issues and go to whoever your physician is, and they should be able to sort out and see which requires priority. Not always possible to address everything in one visit. They may want to call you back and discuss the non-urgent ones, but hey, let them decide what they think is more urgent.
Yeah, to add to that point too, having a symptom diary, I think it's really important. If you're seeing, for example, just having some abdominal pain, sometimes that can get ignored. But if you see, for example, blood in the stool, right? So I think it's important to dissipate that information to your PCP that, hey, I'm seeing blood, so and so. This is the type of blood I'm seeing, and I have some family history too. So could you please help me in figuring out if there is any other thing which I need to be worried about? And pointing to the earlier question as well, sometimes we don't have to get colonoscopy all the time, right? Like there are different screening methods too, and PCP can always pick those for you. And if that turns out to be positive, then you can always have a discussion about getting a colonoscopy. So depending on the comfort and depending on, what kind of symptoms you're having, definitely your primary care physician can navigate that path for you to getting a colonoscopy.
Yes, phenomenal answers. And so following up with that, community members want to know, can you get colorectal cancer without the sign of polyps? I know we already talked about like, no symptoms, screening is better if you don't have any symptoms, but can you get colorectal cancer if you don't have polyps? Just wondering.
Yes, so colon
Unfortunately,
cancer.
yes. Yeah. Go
Yes,
ahead. Go ahead.
exactly. So
Hmm.
like this is one of the hereditary cancers that we spoke about, which can arise without a typical polyp phase. Lynch syndrome is what it's called, and they can develop directly from the lining without any visible polyps. That being said, Lynch syndrome, they generally have family history of other cancers and colon cancer. So people have a high index of suspicion. These patients get scoped starting from a very young age, sometimes in their 20s and 30s, they start colonoscopy. However, the different types of polyps in those who develop cancer from polyps. Even though we've just used the word polyp in our discussion today, it's important to note that there are different types of polyps, and some progress faster to cancer, whereas some take a longer time to progress to cancer. And that's why a gastroenterologist, based on the number of polyps you've had and the type of polyps you've had, makes a recommendation about when you should be repeating your colonoscopy.
One thing I wanted to add to that too, all these recommendations are made after having a robust research background based on what are the patterns of colon cancer has been for ages and centuries. So if someone who is healthy and who is not having any symptoms, getting screened at 45 makes sense because that's how the pattern has been of colorectal cancer. If someone has some history of colon cancer in families, and that's why we have like specific recommendation when it comes to the screening when someone has all these risk factors. So always listen to your PCP. Always make sure that you understand the guidelines based on what specific recommendation someone is coming with. And again, there will be, unfortunately, there will be some scenarios where colorectal cancer can get missed, and that's the unfortunate part of this. And that's why, having this holistic approach definitely helps.
Phenomenal. So about a holistic approach, then I think let's talk about something that we can control. So I know we talked about this a little bit, but I still know that it's going to be a burning question. Is there a link with our food system, and can be anything done to get harmful ingredients out? And I think they're talking about with correlations to colorectal cancer. So I just really
So,
want to drive that point home.
no, absolutely. So I think the pattern of colorectal cancer definitely changed in past few decades, because there was exposure of synthetic food materials in our day-to-day life. So I think cutting down anything which is processed, things like processed meat, anything which has a lot of synthetic ingredients, I think those are definitely too high, and the most important things which you should definitely eliminate from a diet. Processed meat, number one, anything which has a lot of preservatives. Uh, Again, there are definitely good studies which have shown some link, and these are like genetically engineered class one carcinogens. When it comes to when it can cause any changes in your gut lining, and probably that's where this colorectal cancer basically starts in younger folks as well, because if you consume those products a lot, that kind of makes it kind of creates a trigger environment for your gut to cause those changes, and those changes becomes polyps. And if those goes undetected for a long period, then you can definitely have something like a colorectal cancer.
I definitely can understand that. Thank you so much for giving some insight on that. I think the community really enjoyed that one. So, following up with another pressing issue that I think quite a few people might have some concerns about, are there any known comorbidities between having had COVID and colorectal issues?
Hmm. So that's a good question, Jarel. So, COVID-19 has had a plethora of effects. I would say the effect we've seen with COVID is a lot of GI symptoms, whether it's diarrhea, abdominal pain, nausea. Indirectly, a lot of lifestyle effects from COVID have arisen, whether it's less physical activity, increased alcohol consumption, and we know that these are triggers which can potentiate colon cancer. Especially in the pandemic, we saw an increase in alcohol consumption. So right now, there is no direct causation between COVID and colorectal cancer, but I would say these indirect ways where you've seen increased alcohol use or less physical activity, those can cause colon cancer down the line.
Can I actually respond briefly to that? So I was part of the Recover study, which is the long COVID study. That was a national study at UCSF, and the folks that we were working with there actually were doing biopsies on people up to 3 years, 2 years out from having COVID, and they are able to find evidence of the COVID virus in the rectal mucosa. So you can imagine that if there is something there that's not making you sick, your body is still trying to fight it. So that chronic inflammation, we may actually see some increased incidence of rectal cancers related to COVID. So, and those biopsies were positive in people who did not have symptoms of long COVID. They felt fine.
Oh, that's good to know.
FYI, I'll put the link in the chat for the paper.
Please,
Absolutely.
thank you
Thank
for
you.
that ground zero information. Yes. Okay. So, following up with that question, because I know I want to get everybody's questions as soon as I can. I want to ask, let's see, I want to close out with that. I'm gonna ask, is there a link between diverticulitis and colon cancer?
To answer that, long story short, no. However, any episode of diverticulitis should have a follow-up colonoscopy if not done in recent time. And the reason behind that is sometimes diverticulitis can hide indolent cancers and polyps. So if someone got an episode of diverticulitis in 6 to 8 weeks post attack, once everything is resolved, they should undergo a colonoscopy just to make sure that there is no hidden polyp behind that, or there is no cancer going on in the setting of diverticulitis. Because when you get CT scans, diverticulitis looks as like inflammation of that colon wall, and that can be misinterpreted sometimes too. So once that attack is resolved, you should get the colonoscopy afterwards.
Exactly. So the diverticulitis does not lead to colon cancer, but since the two look the same on imaging, they do recommend getting a colonoscopy 6 to 8 weeks, like Dr. Kumar said, after an attack of diverticulitis to make sure there's no underlying cancer that provoked it.
Okay. So, okay, next question. What systematic gaps are leading to so many diagnoses happening in emergency settings? And how can we change that through better screening and awareness? That question was asked by a community member.
That's a heavy question,
It is.
but
That's I said I want to leave it with a thought provoking.
so
And it's okay to be like that. We need to work together and discuss, but I did want to get you guys'
exactly.
thoughts, at least for, and maybe a charge to the community and see what they think too. So, yeah.
Hon Honestly, I feel like since you guys had mentioned COVID earlier, COVID
Mhm.
created a big backlog in screening. And we have this backlog of screening colonoscopies, and patients are taking months to come in just to get their screening colonoscopy. So that is one thing we're working. It's a bigger system-wide issue, nothing that you and I can take care of. But apart from that, spreading awareness is what we can do to bridge this gap. And I'm glad we're having this conversation today.
Yeah. I personally feel that there should be more colon cancer awareness month, not just March, because we have so much to cover.
Absolutely agree. No, I absolutely agree. And with that being said, let me see. Am I on time to end Q&A? Do I have to end and keep going, guys? Somebody tell me. I can't see the clock.
Didn't know if we were going to slip one more question in here,
Yes, let's slip one more. Let's
or
slip a close one in
not.
for the community.
I thought the question about right and left-sided colon cancers, I don't believe we've addressed that as
Yes.
far as differentiating outcomes, treatment.
I definitely agree. And so
Would you
that
speak to that
question
a little
is,
bit?
yeah.
Good.
So that question,
Absolutely, yeah.
mhm.
All
So
right,
does it
so
So
really
great.
matter whether colon cancer develops on the left or right side? Just wanted to know. Yeah, that was the
So
question.
great question here. I would say that the right-sided colon cancers are the ones that tend to be more subtle in presentation. Because these tumors often grow larger before they're detected. So the right colon leads to the transverse colon, that leads to the left colon, and left colon opens out via the rectum. So on the left colon, on the other hand, which is almost close to your exit or the rectum, the change in bowel habits is a symptom that we commonly see. So patients may have these symptoms and present earlier. These tumors tend to cause obstruction. On the other hand, right colon cancers are more silent and tend to be diagnosed at a later stage. So I would say, apart from the diagnosis and symptomatology, even when we are doing our colonoscopies, the right colon polyps, these sometimes are a different variety which grow quicker because there's a different genetic pathway for them and they can grow faster into cancer. So overall, though, in terms of treatment modalities, the surgeons and the oncologists decide how to manage from that point on. In presenting symptoms and in the endoscopic appearance, they may differ.
But so as a surgeon, I will say a right colon cancer is much easier to resect. It does not require radiation because that's reserved for the rectum. And there's much more, so the rectum's on the left side. Right-sided cancers, I actually think there is a paper, and the survival is better in right-sided tumors, even though they present later. Left-sided tumors, you're in the pelvis, you're around a lot of nerves and a lot of function for, ejaculation, erections, evacuating your bowels, etc. There's much more morbidity there. And it does require radiation. So those outcomes tend to be a little more like the burden, the morbidity of, what we need to do in order to treat those cancers tends to be a little more extreme, I'd say.
Okay, thank you. All right. So with that being said, that was our one more question, I believe. And so I want to thank you again to our speakers just for hearing our questions. If we didn't get to your question, please don't feel like that won't get answered as usual in our follow-up. We will kind of try to get those answered. So the Massey Community Cancer Forum meets on the fourth Tuesday of the month, and next month's topic will be cancer research and clinical trials. Our speaker will be Dr. Khalid Mateen, and it will happen on April 28th, 2026 from 1 to 2 p.m. So if you haven't already, we're asking that you scan to register, share it with your friends, bring a friend with you next time. And if you and please, if you haven't already, please help us improve the forum and fill out our survey and evaluation.